Hi everybody, back at it again. Right, so we're building off our last block of information where we talked about signs and symptoms of diabetes mellitus, of which there were many, right? So we can certainly see the concern for this pathology in terms of overall health and well-being, right? It impacts a lot of systems, right? Cells and organs, and we'll be expanding upon that discussion with this latest video here. Okay, so you might see some crosstalk between signs and symptoms and then these warning signs or complications associated with diabetes mellitus, right? Before we dive in, right, I like to take the 30,000-foot view, the big overarching objective and point of understanding that we're trying to glean from this discussion is that diabetes mellitus is a big deal, right? And it's not just an issue associated with it's just a little bit too much sugar in the blood, right? That chronic exposure of high sugar in the blood is really deleterious to your health, right? And your patient's health, your athletes who may be living with, once again, this idea of uncontrolled diabetes mellitus, right? So it's going to impact a lot of physiology and a lot of different organ systems throughout the body, which we'll be talking about today. So it's something that needs to be taken very seriously when there are signs and symptoms that are presenting. And certainly these warning signs, complications that we'll be discussing here. Okay, so with that said, one of the areas of the body in terms of anatomy that gets impacted by excessive and prolonged sugar exposure is we start to see problems with nerve conduction and damaging impacts to the nerves, right? In particular, the nerves that impact the periphery, the hands and the feet, right? So what we start to see with this prolonged exposure to excess sugar in the bloodstream is referred to as numbness or tingling. All right, the medical term we see for this is referred to as paresthesia. P-A-R-E-S. Paresthesia. I'm misspelling that. My spelling is terrible. I'm sure you can see that in the videos how bad my spelling is. I try my best. Paresthesia, right? So loss of sensation, numbness, and tingling, particularly to the hands and feet. All right, so we start to lose this sensation due to the nerve damage and the loss of the conduction of nervous signals back to the brain, right, associated with this hyperglycemic load, right? And this is really a concern for the clinicians out there and obviously the patients themselves, right? Is that when we start to lose sensation, but maybe to the bottoms of the feet, right? And we talked about particularly related to type 2 diabetes, right? One of the major factors that will cause early mortality, right, and morbidity, right, is in the elderly population, right, is loss of balance and coordination and falls, right? The number one point of treatment for individuals looking to go into gerontology, right, working with the the advanced aging population, is that we really have to pay attention to avoiding the falls, right? Falls will just erode the future health and cause early mortality and death in patients of advanced age. So we got to pay attention to the falls, right? And when individuals start to lose sensation, particularly in the bottoms of the feet, it can contribute to these problems of loss of balance, loss of coordination, and falls, right? So it's something we got to pay very close attention to, right? So this idea of diabetes can contribute to that problem, right? And the other issue is going to be tied into another complication is individuals, because they lose sensations at the bottoms of the feet, right? So not only do we see, there's maybe loss of balance if it's to the bottom of the feet, we also see this loss of sensation, this numbness, right, which can lead to then increased ulcers, and sores on the bottoms of the feet, right? So as patients, maybe they develop a blister for walking purposes, and there's a maybe older shoes that causes a problem. If you don't have the paresthesia, right, you can sense that, you can feel it, and you can treat it. Sometimes these patients don't even know that they have, a skin irritation or a problems on the bottom of the feet, and then that can lead to these ulcers and gangrenous formations. And then there's problems with the skin wound healing, which we'll allude to. So individuals with diabetes can lose toes, they can lose feet with amputations because of infections that can occur as a result of this loss of sensation, ulcers and sores that form at the bottom of the feet. So it's something we want to pay attention to as clinicians for our patients that are living with diabetes, right? And we're trying to treat is, we've got to make sure we're paying close attention to the bottoms of the feet, making sure those are well cared for. Regular appointments maybe with a podiatrist to make sure shoes are fitting right. There's regular care and maintenance to the bottoms of the feet to avoid these sores and ulcers, and also work on the balance and the coordination, and as a physical therapist to make sure there are no falls, right? And particularly for more of the geriatric population, right? So something you want to keep in mind. It's very important, okay, for the care of your future patients, all right? This paresthesia, numbness, tingling issue, right? Second on our list kind of ties into what we referred to before with these vision problems that go into glucose challenge issues in the body, right? So we see impairments, impaired vision, okay? And this could be in part due to what they call in diabetes situations, they will refer to this as a diabetic retinopathy. A diabetic retinopathy with a retina, right? This back part of your eye that's responsive to light, right, starts to become degraded, right? And this retina is a very enriched, blood vessel rich environment, right? And as we kind of tie it into our future discussions with cardiovascular, but because, as we alluded to before, this sugar load that's in the blood causes what's referred to as glycation, right? So increased sugar in the blood leads to glycation. That's the fancy medical term that I call candy caning, right? Where the organs, the cells, the blood vessels have this sticky, gooey kind of appearance, right? And sensation inside the blood, and it kind of like a candy cane. It starts to crystallize and cause problems and coat all the cells and the organs with sugar molecules. We refer to that in cell biology as glycation. And that'll circle back in our future discussions when we talk about maybe key diagnostics that are used and treatments for diabetes, and some of them are really associated with this glycation in the bloodstream, right? So as the blood vessels of the eye and the retina become glycated and damaged and frail, we can see damage to the blood vessels, right? And then we start to see diminishments in oxygen delivery to the cells of the retina, causing blindness, right? So we call that diabetic retinopathy from the damage to the blood vessels, feeding the eye with necessary oxygen, right? So this diabetic retinopathy related to this glycation situation of excessive sugar in the blood, right? If the condition impacts, it also impacts the macular area, right? So the macula, right? We see this macular edema, right? So diabetic macular edema being the medical term for swelling, right? So we see this swelling and accumulation of fluid in the eyeball, calling intraocular pressure issues, damage to the macular area of the eyeball, which is where the optic nerve gets hooked into. So all the wonderful colors that we're able to see start to become degraded as is this swelling, and macular pressure begins to be built by the damaging effects of diabetes. So it's referred to as diabetic macular edema, right? So big picture takeaway, once again, is vision can be really impacted by problems with excessive sugar loads, glycation from diabetic issues, right? So and vision, right? Retinal damage and so forth, right? Enough said on that. Enough said on that. Okay. Related to our previous discussion on my list, I have a slow healing, right? So we have impaired or slow healing. All right. So we see general decrements, right? Decreases in overall immune function, right? Can be occurring from excessive sugar loading. Once again, this glycation issue and this candy caning of the physiology is going to impact a lot of different cells and systems, and including the immune system, right? So going back to our previous discussion where individuals maybe have a sore, at the bottom of the foot, right? That sores are going to require a kind of an immune and an inflammatory response to allow that area to heal, right? And we know that under these excessive sugar loads and glycation associated with hyperglycemia, that the immune response, the inflammatory response that's needed is suppressed and hindered. So these sores, even if we recognize them, it's going to be difficult to treat and get that to be remedied because of the impaired immune function, right? So, it's a problem with, this overall skin wound healing and sores and general cuts. They're going to have a problem with getting those to close because of this impairment in overall kind of immune function and responsiveness due to this glycation coating and negatively impacting the immune cells that are in the bloodstream, okay? So that's an issue, right? Oh, let me go back to my black color. Keep things consistent. Right? Alright, so maybe what's next here so I don't forget it as a condition. Acanthosis nigricans. Alright. So acanthosis nigricans is a warning sign. It's a darkening of the skin. So we see some skin changes that can occur with excessive sugar. Obviously, the skin is a blood-rich environment. We can see it, this darkening sometime in the armpits area, the groin, maybe the neck. So it's a darkening of the skin, more like a velvety dark color, so darkening patches of the skin, right, in areas of the armpits, maybe the groin, the neck region, right? And this could be totally benign. This could be a totally naturally occurring just skin appearance, but the unusual appearance of these darkening areas of the armpits, the groin, the neck, this acanthosis nigricans could be indicative of maybe of diabetes, particularly if you couple with all the other warning signs and symptoms. It may draw the attention, and it's more common to see this in the African American community than other communities. So you want to be paying attention once again if you're working with a community that has a greater prevalence of African Americans in the community. This would be a particular a warning sign you maybe wanting to pay attention to. Once again, this idea that these signs and symptoms, warning signs, conditions have different prevalences across society. So we don't just want to have a generalization. We want to be more targeted and be more savvy as a clinicians in terms of and being best to treat the patients in our communities. And some communities have different prevalences of conditions and different ethnicities and different races in our communities, and they have different needs, right? So we want to make sure we're paying attention to the needs of the societal issues of the communities that we're going to kind of try to treat. Okay, so be aware of this potential warning sign. Once again, it can be completely benign and normal, but once again, coupling with the others is something maybe you want to be paying attention to, particularly if it's an abnormal onset. We've never had this before, and all of a sudden I'm noticing darkening in the armpits, neck, groin. What is this about? It could be indicative of excessive sugar. Okay, so. All right, good. All right, let's continue on now, right? Let's continue on. I'm going to create a new page. This is continuing now. So So warning signs, complications continued. Okay. So the next on our list, number next, okay, we can see, once again, if you go up and down the body, it's going to be pick an organ, pick a cell, and there's going to be a complication associated. Diabetes is just this non-discriminatory type of pathology that's going to impact everything. So you can pick a cell, a system, an organ, and it's going to have an impact if there's uncontrolled diabetes in the situation. Okay, so we can talk about erectile dysfunction. All right, once again, affecting blood flow, right? So we can see erectile dysfunction. We can see issues associated with increased yeast infections in women, right? Yeast infections, right? Yeast loves to feed on sugar, so and that excessive sugar once again is coming through, and it could be feeding yeast infections. So we see an increased number and frequency of yeast infections. It could be indicated of an excessive sugar load, right? So these are maybe not commonly thought of as complications associated with diabetes, but certainly you want to pay attention to these. If there's increased rate of these in the patients and the clients you're working with, they're reporting this. So it should be jump out as, ooh, maybe there's an issue here related to blood sugar. Maybe we should look into some diabetes types of things. Okay, not always. Obviously, there's other causes for these types of conditions, but certainly it's corollary to diabetes mellitus. Okay, so and we continue on here, right? We see increased risk or prevalence for some very common conditions, like we see increased risk for stroke, right? Once again, the likely cause for stroke is diminishments in blood flow, right? We talked about the negative consequences of this glycation in the bloodstream, and we'll tie it in nicely to our future discussions on atherosclerosis, right? So, which is really the narrowing and hardening of the blood vessels, right? So if that narrowing and hardening of the blood vessels occurs in the brain, that can lead to stroke, okay? So something we want to be aware of, this kind of metabolic syndrome we talked about, is problems with diabetes cross-talking to problems with the heart, problems with stroke and blood flow to the brain, right? So we want to be aware of that, this increased prevalence for atherosclerosis, right? So tying into that same discussion, we see increased risk for heart attack. All right, we referred to that previously. This is that classic metabolic syndrome, all right? So atherosclerosis related, and it's not unrelated to the eye issues, right? Atherosclerosis and impacting the blood vessels of the eye. It's all kind of the same milieu, fancy word, right? For the environment that's created due to this hyperglycemia causing problems with blood flow, okay? And then related to that, we see increased risk for kidney disease, right? All right, this is a big issue, right? You start negatively impacting the kidneys. The kidneys are filtering out all of our toxins, and as the kidney health goes down, the overall systemic bodily health will also rapidly decline. So you see this as CKD, right? Chronic kidney disease, right? So individuals start to develop advanced chronic kidney disease. Now we're talking about dialysis, where you have an external machine that operates like an external kidney to filter the blood. Individuals have to get that done several times a week, right, to filter out toxins that are in the bloodstream, right? So it's really has a negative impact on the overall quality of one's health, where they're constantly having to go into the hospital or a medical facility to get their dialysis treatments. So it's really burdensome for one's life and the quality of life when we start involving the kidney. And you really start involving the kidney, it gets very difficult to manage the overall bodily physiology in terms of acid-base regulation, and all sorts of problems start to arise when we start to get kidney problems, okay? So it's really problematic, all right? So I think that's my overall list. I know it's not a short list. It's the overall takeaway, the 30,000 foot view is diabetes is a problem, right? We got to start to deal with this issue of the high prevalence of diabetes in society because it's just so deleterious to health and physiology, right? So if we can prevent it, it's the best. That's what we're trying to avoid is the onset of diabetes. Obviously, type 1 is more problematic because the cause is a little bit different than type 2. But with that said, overall, as we learn to prevent and or better manage diabetes, so goes with it the improvements of health and well-being of individuals in society, and also tied into medical costs and those types of situations, and also the quality of life of our patients will go up dramatically as we can learn to prevent as much as we can, better manage and treat these types of conditions as we learn more. Okay, so hopefully that was informative for you, right? And keep up the good work, and we'll continue to build from here, right? Thank you.